and to carry on. After an injury, there's 3 phases of healing. One of them, or the first one, is we get the inflammation. It's called inflammation, that phase. And it's a phase in which there's going to be swelling, there's going to be maybe redness of the area, there's going to be pain in the area. The pain neurons become activated. All nerves learn. So pain neurons can get too good at their job. We'll talk a little more about that later. The next phase is repair, and that is where adhesions and scar tissue starts coming in and forming. And the third phase is remodeling. That's where you strengthen, where you gain the range of motion back, the efficiency and the coordination of the area returns in that phase or by that phase. If the pain remains, we go through these phases in might be 2 weeks, but usually it's a couple of months. And they can go even a little further out, but if you've had pain for a couple months or years, your body has healed that way. If it's still hurting, it has healed hurting. And that's fairly common with chronic pain. So what happens then is the pain neurons have been hypersensitized. That means it takes less to activate them, less to have pain from doing any of your activities of daily living. The tissues do not move as much. That area tends to be more restricted because of the scar tissue. It hasn't been thoroughly worked out. Even subtle things. For example, a person will say, oh yeah, I can turn my neck like that. Well, that's only about half the normal range of motion. You should have about 80 degrees. I was showing about 45 degrees or so of rotation. That restriction in motion is going to not activate the pain suppression neurons. The pain suppression neurons, or part of them, part of that mechanism that our nervous system suppresses pain with, requires good movement of joints and muscles. If there's not sufficient, it will not be activated adequately, and it contributes to the chronic pain. So solutions for that. Well, I reverse this with stretching. We can use exercise, joint manipulation. If the joint does not move properly and sufficiently, it's not going to be activating that system adequately. And therefore you've got scar tissue that is built up and now is painful. The joint's not moving enough, so now the muscles and the joints do not activate those pain suppression neurons, and we've got more pain. One of the best things I've ever seen in my 35 years of practice is a treatment called active release treatment. It has literally changed the lives of myself and many people, my patients. It takes months of training and years to become a master at it. It entails certain ways of applying deep pressure on the area and stretching it simultaneously. Then we will, it's very effective at returning a person's range of motion back. Yeah, it does work out those sore areas, and so there is some pain, so we just go to your, tolerance and gradually work it out. And when that happens, people regain that motion, the pain suppression neuron activity improves, and good range of motion, and it also allows you now tolerance to exercise. Sometimes people go to physical therapy and they fail. They come and see me. Well, we get the joint and the areas working properly and get the pain levels down so they can start strengthening that area up, and then the rest of the phases of healing are going to be reached, and they're going to be feeling much, much better. Spinal manipulation, that type of treatment is very effective when it comes to helping the nervous system recover and respond normally. I used something called the neon argon photon generator. What it does, it provides energy into the tissues to help them heal better and reduce swelling and flush out the tissues. An area of injury becomes toxic, and that also activates pain neurons. So we want to work on this from different angles. I also use nutritional aspects to this. And that's pretty much it. I want to now have Diane tell you about her experience with helping her. She had 5 rotator cuff and a bicep, 4 rotator cuff muscles and a bicep tendon torn. And she'll give you her story. Thank you.